So classically, when you think someone has herpes, you're taught that you're supposed to use a swab similar to this, and you're basically supposed to rub the top of the vesicle and rupture it, and then collect the fluid on this, and then place it in the media to actually get the culture performed. I find that most patients find that very uncomfortable because the vesicles are quite sensitive and it's tender around them. So you're lucky if they don't kick you or bite you or not like you anymore. I have a different technique to get the sample, and it actually is less discomforting, and it actually is more liable to give you the proper diagnosis. So basically what you want is, say you've got vesicles that are present, the fluid that is present in the vesicle is teeming with viral particles. So you want that fluid collected. Well, if you rub it, it's going to rupture, and then some of it may get on the swab, but you might miss some of it. Actually, by using a small syringe, like a tuberculin syringe or an insulin syringe, it's barely noticeable, even on a tender spot, to actually infiltrate the vesicle and suck the fluid out, and that's teeming with virus. The only problem with even a small needle is the amount of fluid that's in the vesicle is relatively small, and if you just use air to try and express it out of the needle, it may not be effective in getting the culture actually out of the needle. So my suggestion is that prior to actually infiltrating this vesicle and draining it, you actually take your sterile syringe and you put it in the media and aspirate some of the media up into the syringe so that you have some liquid media. Then you back it off so that there's air in between, and then you can actually inject this into the vesicle and aspirate the lesion. The fluid that you're collecting will probably be in the needle and maybe in the very beginning of the hub, but now that you've got a fluid media behind it, rather than just depending upon the air to express it out, you've got the fluid, and it'll actually push it back, and you just inject it back in here. So you don't actually need to use the swab, and you don't have to rub, and the patient's going to be much more comfortable having had it sampled. And I have very low likelihood of a negative test in the patients that I am convinced clinically have active herpes. So it's a very effective and more humane way of collecting, and I think more likely to give you a true result when you're culturing for HSV. I hope that's helpful.
Thank you.